My name is Dr. Haim. I'm a general surgeon in a small town outside of Dallas. And I was the whistleblower who exposed that TCH was lying about the existence of their transgender program. And I'm sure that many of you are wondering, there's so much deception in this field. Where are the doctors? Why are there not other doctors who are speaking up? And all of this happened with me blowing the whistle during my training. And I saw it firsthand myself. There is a code of silence that exists among physicians in the profession today. If you break that code, then you will be targeted in the most vicious way possible. Because when I found out that the hospital I was working at, Texas Children's, which is one of the most amazing hospitals, in the country for taking care of kids, but they had this program that was harming these kids that had no basis in scientific or biological reality. They were doing this to children and they were lying about it. So I blew the whistle in May of 2023. There was a law passed the next day, more whistleblowers spoke out, and the hospital said that they were shutting down the program. But in response to that, I was targeted by the most powerful federal leviathan in human history. They tried to send me to prison for 10 years. I was charged with more felonies than some of our country's most prolific criminals. And this was for a crime that I had never committed, that the DOJ could never even define, where no patient had actually been harmed. They were using HIPAA as a basis for their indictment, even though the victims, they said, were the hospital and the doctors.
Why, in your view, has politics and ideology, how has that been allowed to stay in this type of medicine?
It's a decades-long process where the institution of medicine had been taken over by radical left-wing ideologies. And as that creep has taken a hold in these institutions, people who spoke up were increasingly vilified. So people would suffer the traumatic experiences of speaking out and then having their professional lives damaged. Either they would be fired, they would be held back from promotions, they would be sometimes targeted by governing medical authorities in their state. And in cases like mine, they would be targeted by the federal government. So you have real consequences to the doctors who speak out against this. And that is happening in conjunction with the professors at medical schools, the clinical doctors who are teaching medical students in residence. All of the people who are promoted, who are hired, are not the ones who hold conservative values, or not even conservative values, just not radical values, right? Like being an average person essentially eliminates your ability from being hired in these prestigious academic centers.